Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 5th, 2025. This video is in a New England Journal of Medicine article published on September 30th, 2025, titled Sotatercept for Pulmonary Arterial Hypertension Within First Year After Diagnosis. Pulmonary arterial hypertension is progressive and deadly due to vascular remodeling and right ventricular failure. Sotatercept targets TGF-β superfamily to rebalance signaling and reduce remodeling. Prior trials showed benefit in long-standing pulmonary arterial hypertension. The effect in early pulmonary arterial hypertension, however, was unknown. This was a phase 3 randomized controlled trial conducted by the HYPERION clinical trialists. The lead author, Dr. Valerie McLaughlin from Michigan. She was my colleague when I was there many moons ago. These investigators enrolled 320 adults with pulmonary arterial hypertension of less than 1 year diagnosis, WHO class 2 to 3. Treatment Sotatercept 0.3 milligrams titrated up to 0.7 milligrams per kilo subcutaneous Q21 days versus placebo on background therapy. Median follow-up 13.2 months. Primary endpoint time to clinical worsening, which includes death, hospitalization, exercise decline, etc. The sample size planned 444, stopped early after the Zenith trial showed benefit. What did these investigators find? Clinical worsening 10.6% in the Sotatercept group versus 36.9% in the placebo group. Hazard ratio 0.24, p-value less than 0.001. Week 24 walk distance increased by 29.1 meters in the Sotatercept group. NT-proBNP decreased by 199.3 picograms per ml. And WHO class improved to 1 to 2 in 55.2% of the individuals. Deaths 4.4 in the Sotatercept group versus 3.8% in the placebo group. Limitations: trial stopped early, 17% did not reach week 24. Quality of life outcomes underpowered, long-term safety unknown. Key takeaways: early Sotatercept significantly reduces risk. Number needed to treat 5 over 12 months. Most adverse events were mild: epistaxis, telangiectasia, and increased hemoglobin. Eponyms related to pulmonary arterial hypertension: the REVEAL risk score, the COMPARA score, and the WHO functional class. The REVEAL risk score is the registry to evaluate early and long-term pulmonary arterial hypertension disease management. Incorporates WHO functional class, NT-proBNP, 6-minute walk distance, blood pressure, heart rate, and kidney function. The COMPARA score, or comparative prospective registry for pulmonary hypertension, classifies 1 year risk, low to high, using WHO class, NT-proBNP, and 6-minute walk distance. The WHO functional class classification stratifies patients by symptoms class 1 to 4. It was adapted from the NYHA class. Clinical pearls: Sotatercept is a first-in-class activin signaling inhibitor targeting TGF-β superfamily ligands. There's significant reduction in clinical worsening when added to background therapy, hazard ratio 0.24. Benefits appear early. Divergence in survival curves noted after just 3 doses. Most benefit driven by fewer declines in 6-minute walk distance and fewer hospitalizations. Watch for epistaxis, telangiectasia, and increased hemoglobin, mostly mild and manageable. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.